While staying active is a cornerstone of healthy aging, offering a multitude of benefits from cardiovascular fitness to mental well-being, it's crucial to acknowledge that the ideal level of physical activity isn't one size fits all. For some older adults, what is generally considered a health-promoting activity like walking can paradoxically become detrimental, exacerbating existing conditions, increasing the risk of injuries, and placing undue stress on the body. Doctors and geriatric specialists increasingly emphasize the importance of individualized exercise plans, recognizing that the same level of physical exertion can have vastly different outcomes depending on an individual's health status and pre-existing conditions. This comprehensive guide delves into 5 specific groups of older adults who may need to carefully limit their walking to safeguard their health and prevent serious complications. It's essential to understand that this isn't about discouraging activity altogether, but rather about promoting a balanced approach that prioritizes safety and well-being while adapting exercise routines to individual needs. Recognizing potential risks and making appropriate adjustments can be the key to preventing health setbacks and ensuring a higher quality of life for seniors. 1. Individuals prone to severe blood pressure fluctuations. Maintaining stable blood pressure is crucial for overall health, particularly for older adults. However, those who experience significant blood pressure fluctuations, whether sudden drops, hypotension, or spikes, hypertension, may find that excessive walking can lead to serious health consequences. Understanding the risks. Orthostatic hypotension. This condition is characterized by a sudden drop in blood pressure upon standing or walking, leading to dizziness, lightheadedness, blurred vision, and even fainting. When blood pressure plummets, the brain doesn't receive enough oxygen, causing these symptoms. Falls resulting from orthostatic hypotension can lead to fractures, head injuries, and other serious complications. Uncontrolled hypertension. On the other end of the spectrum, uncontrolled high blood pressure makes physical exertion dangerous. Increased physical activity elevates blood pressure, which can strain the heart and blood vessels. This heightened strain can increase the risk of stroke, heart attack, and other cardiovascular complications. The most significant danger is the unpredictable nature of blood pressure fluctuations. An individual might feel perfectly fine at the start of a walk, but within minutes experience debilitating symptoms. This unpredictability makes it particularly risky for seniors who walk alone, as a sudden episode could lead to a fall in a public place with no immediate assistance available. Beyond diagnosed conditions. It's crucial to remember that blood pressure instability isn't always a diagnosed condition. Many individuals may not realize their bodies struggle to regulate blood pressure properly until a dangerous episode occurs. Subtle symptoms like occasional dizzy spells or lightheadedness are often dismissed as just a part of aging, leading to potentially dangerous situations. Case study: Eleanor's experience. Eleanor, an 82-year-old who had always been relatively active, experienced occasional dizzy spells when standing up quickly. Attributing it to old age, she ignored it. One morning during her usual walk, she suddenly felt her vision darken and collapsed, fracturing her wrist. Following an evaluation, her doctor revealed that Eleanor's body struggled to regulate blood pressure with movement. She needed to adjust her walking routine, stay hydrated, and use a mobility aid for stability. These changes allowed her to remain active without the previous risks. Strategies for safe walking with blood pressure, fluctuations, Hydration. Dehydration can exacerbate blood pressure fluctuations. Drink plenty of water throughout the day, especially before, during, and after physical activity. Walking aids. Using a cane or walker provides added stability, reducing the risk of falls caused by dizziness or lightheadedness. Regular blood pressure monitoring. Monitoring blood pressure before, during, if possible, and after walks provides valuable insights into how the body responds to exertion. This information helps individuals and their healthcare providers make informed decisions about exercise routines. Medical evaluation. If you experience frequent dizziness, sudden weakness, or extreme fatigue during walks, consult a physician. These symptoms could indicate underlying blood pressure issues that require medical attention. Low-impact alternatives. Explore safer, low-impact exercises like seated leg lifts, stretching, or balance exercises. These activities can improve fitness without placing excessive strain on the cardiovascular system. Ultimately, understanding your limits and working in conjunction with your healthcare provider is paramount. Walking can be beneficial, but for those with unstable blood pressure, it requires careful planning and execution. 2. Individuals with chronic heart conditions. For many seniors, walking is an excellent way to maintain a healthy heart. However, for those with pre-existing heart conditions, excessive walking can place a dangerous strain on the cardiovascular system. Individuals with heart failure, arrhythmias, or unstable angina need to be particularly cautious about overexertion, as it can lead to serious consequences. Understanding the risks. Heart failure. In heart failure, the heart struggles to pump blood efficiently, leading to fatigue, shortness of breath, and fluid retention. Excessive walking places additional strain on an already weakened heart, potentially leading to decompensation, worsening of heart failure symptoms. Arrhythmias. Arrhythmias are irregular heartbeats that can range from harmless to life-threatening. Strenuous physical activity can trigger arrhythmias, increasing the risk of dizziness, fainting, and even sudden cardiac arrest. Unstable angina. Angina is chest pain caused by reduced blood flow to the heart. Unstable angina is a particularly dangerous form of angina that can occur at rest or with minimal exertion. Excessive walking can trigger angina episodes, increasing the risk of heart attack. The heart works harder with every step, and for someone with a compromised heart, excessive walking can push it beyond its safe limits. This can lead to a cascade of negative effects, including dizziness and lightheadedness. Reduced blood flow to the brain can cause dizziness and lightheadedness, increasing the risk of falls. Breathlessness. The heart may not be able to pump enough oxygen-rich blood to meet the body's demands, leading to shortness of breath. Chest pain. Angina can occur when the heart muscle doesn't receive enough oxygen. Sudden cardiac events. In severe cases, overexertion can trigger life-threatening arrhythmias or heart attacks. The challenge of unpredictable symptoms. One of the biggest challenges with heart conditions is the unpredictable nature of symptoms. An individual might feel fine at the start of a walk, but experience chest pain, an irregular heartbeat, or severe fatigue after just a few minutes. Many people mistakenly believe they simply need to push through the discomfort, but these are crucial warning signs that the heart is under too much stress. Ignoring these signs can have dire consequences. Case study: Edward's experience. Edward, a 79-year-old man with mild heart disease, enjoyed walking in the mornings. However, he noticed that Even short walks left him unusually tired and out of breath. Instead of slowing down, he tried to build endurance by increasing his distance. One day, he experienced severe chest tightness and dizziness and had to be rushed to the hospital. His doctor explained that his heart couldn't handle the physical stress and that he needed a carefully controlled exercise plan. By switching to short, supervised walks and gentle strength exercises, Edward was able to maintain his health without endangering his heart. Strategies for safe walking with heart conditions. Medical clearance. Before starting any exercise program, consult a cardiologist or other healthcare professional to determine a safe level of activity. Personalized exercise plan. Work with a healthcare provider or certified exercise specialist to develop an individualized exercise plan that considers your specific heart condition and functional capacity. Listen to your body. Pay close attention to any warning signs such as shortness of breath, chest discomfort, or sudden fatigue. Never ignore these signals. Gradual progression. Start with short, easy walks and gradually increase the duration and intensity as tolerated. Interval training. Consider incorporating interval training, alternating between periods of moderate intensity walking and periods of rest or slower walking. Walking aids. Use a cane or walker for added stability. Carry identification. Always carry identification with your medical information in case of an emergency. Avoid extreme temperatures. Extreme heat or cold can place additional stress on the heart. Avoid walking during these conditions. Supervision. If possible, walk with a companion who knows about your heart condition and can provide assistance if needed. Cardiac rehabilitation. Consider enrolling in a cardiac rehabilitation program. These programs provide supervised exercise and education for individuals with heart conditions. By adhering to medical guidance and listening to your body, you can safely enjoy the benefits of walking while protecting your heart health. 3. Individuals recovering from recent surgery or injury. One of the most overlooked risks for seniors is walking too much too soon after surgery or injury. While staying mobile is important for recovery, overexertion can delay healing, increase pain, and even lead to complications. Whether it's a hip or knee replacement, a fracture, or a muscle injury, the body needs adequate time to heal before it can handle extended periods of walking. Understanding the risks. Delayed healing. Pushing too hard can disrupt the healing process, increasing inflammation and delaying tissue repair. Increased pain. Overexertion can exacerbate pain, making it difficult to engage in necessary rehabilitation exercises. Re-injury. Walking too much too soon can re-injure the affected area, setting back the recovery process by weeks or even months. Swelling and inflammation. Excessive activity can increase swelling and inflammation around the injury site, hindering healing and causing discomfort. The primary issue is underestimating the stress walking places on the body. Every step requires the coordinated effort of muscles, joints, and bones. If one part is still healing, it may not be strong enough to support the weight and movement required for sustained walking. This can lead to joint instability, muscle weakness, and an increased risk of falls. Case study: Margaret's experience. Margaret, a 75-year-old woman, had knee replacement surgery and was eager to return to her normal routine. Despite her doctor's advice to take it slow, she pushed herself to walk more than recommended, feeling that she was being lazy otherwise. Initially, she felt like she was making progress, but soon she experienced sharp pain, swelling, and stiffness in her knee. A follow-up visit revealed that she had strained the soft tissues around the joint, delaying her recovery. When she finally adhered to a gradual, controlled walking plan, she healed faster and regained her strength safely. Strategies for safe walking during recovery. Follow medical guidance. Adhere to your doctor's or physical therapist's recommendations regarding activity levels. They will provide a personalized rehabilitation plan based on your specific injury or surgery. Listen to your body. Pay attention to any pain, fatigue, or swelling. These are signs that you need to slow down. Gradual progression. Gradually increase your walking distance and intensity as tolerated. Don't try to do too much too soon. Rest and recovery. Allow your body adequate time to rest and recover between walking sessions. Proper footwear. Wear supportive shoes that provide good cushioning and stability. Walking aids. Use a cane, walker, or crutches as needed for added support. Warm up and cool down. Before and after walking, perform gentle stretches to improve flexibility and reduce the risk of injury. Physical therapy. Participate in physical therapy to strengthen muscles, improve range of motion, and regain functional abilities. Remember, recovery isn't just about movement. It's about giving your body the time and care it needs to rebuild strength without unnecessary setbacks. Prioritize healing, follow medical advice, and listen to your body to ensure a successful recovery. Fourth, seniors with severe peripheral neuropathy. For many seniors, walking feels like a natural, effortless activity. However, for those with severe peripheral neuropathy, a condition affecting the nerves in the feet and legs, walking can become not only difficult, but also dangerous. Peripheral neuropathy can significantly impact balance, sensation, and mobility, increasing the risk of falls and injuries. Understanding the risks. Numbness and tingling. Peripheral neuropathy often causes numbness, tingling, and a pins and needles sensation in the feet and legs, making it difficult to feel the ground properly. Weakness. Muscle weakness can also occur, further impairing balance and coordination. Sharp pain. In some cases, neuropathy can cause sharp shooting pain in the feet and legs, making walking extremely uncomfortable. Impaired balance. The sensory and motor impairments associated with neuropathy can significantly impair balance, increasing the risk of falls. The most significant danger of neuropathy is that the nerves responsible for detecting pain and pressure don't function properly. This means that someone with neuropathy might not realize they've injured their foot, twisted an ankle, or developed sores from walking too much. This can lead to serious complications, including falls and fractures. Impaired balance and sensation increase the risk of falls, which can result in fractures, head injuries, and other serious injuries. Foot ulcers and infections. Numbness in the feet can make it difficult to detect blisters, cuts, or sores. If left untreated, these minor injuries can quickly develop into foot ulcers and infections, potentially leading to amputation. Long-term immobility. Falls, injuries, and foot problems can lead to reduced mobility and a decline in overall function. Case study: Frank's experience. Frank, a 78-year-old man with diabetic neuropathy, enjoyed daily walks. Over time, he noticed his feet became increasingly numb. One day, after a particularly long walk, he discovered a deep blister on his foot. Because he couldn't feel it, he had continued walking for hours. By the time he noticed, the wound had worsened, leading to a severe infection requiring weeks of treatment. His doctor advised him to limit his walking, wear supportive shoes, and check his feet daily for injuries. By making these adjustments, Frank was able to stay active while reducing his risk of serious complications. Strategies for safe walking with peripheral neuropathy. Medical evaluation. Consult a physician or podiatrist for a thorough evaluation of your neuropathy and to receive personalized recommendations for safe activity. Proper footwear. Wear supportive shoes with good cushioning and a wide toe box to protect your feet. Avoid walking barefoot. Orthotics. Consider using custom orthotics to provide additional support and cushioning for your feet. Walking aids. Use a cane or walker for added stability. Safe walking surfaces. Walk on smooth, even surfaces to reduce the risk of falls. Avoid walking on uneven terrain, crowded areas, or in low-light conditions. Balance exercises. Perform balance exercises regularly to improve stability and reduce the risk of falls. Foot care. Inspect your feet daily for blisters, cuts, sores, or other abnormalities. Seek medical attention promptly for any foot problems. Limit walking distance. Reduce your walking distance and frequency as needed to avoid overexertion and foot injuries. Low-impact alternatives. Consider switching to low-impact exercises like swimming, water aerobics, or seated exercises to reduce stress on your feet and legs. For those with severe neuropathy, prioritizing foot care and safety is paramount. Regular medical evaluations, proper footwear, and careful attention to walking surfaces can help minimize the risk of complications and maintain mobility. 5. Seniors with severe arthritis. Arthritis, a condition characterized by joint pain, stiffness, and inflammation, is a common ailment among older adults. While moderate physical activity is often recommended to manage arthritis symptoms, excessive walking can paradoxically worsen the condition, leading to increased pain, stiffness, and long-term joint damage. Understanding the risks. Joint stress. The knees, hips, and ankles bear the weight of every step. When the cushioning cartilage in these joints is already worn down due to arthritis, excessive walking can lead to painful bone-on-bone friction, foot ulcers, and infections. Numbness in the feet can make it difficult to detect blisters, cuts, or sores. If left untreated, these minor injuries can quickly develop into foot ulcers and infections, potentially leading to amputation. Long-term immobility. Falls, injuries, and foot problems can lead to reduced mobility and a decline in overall function. Case study: Frank's experience. Frank, a 78-year-old man with diabetic neuropathy, enjoyed daily walks. Over time, he noticed his feet became increasingly numb. One day, after a particularly long walk, he discovered a deep blister on his foot. Because he couldn't feel it, he had continued walking for hours. By the time he noticed, the wound had worsened, leading to a severe infection requiring weeks of treatment. His doctor advised him to limit his walking, wear supportive shoes, and check his feet daily for injuries. By making these adjustments, Frank was able to stay active while reducing his risk of serious complications. Strategies for safe walking with peripheral neuropathy. Medical evaluation. Consult a physician or podiatrist for a thorough evaluation of your neuropathy and to receive personalized recommendations for safe activity. Proper footwear. Wear supportive shoes with good cushioning and a wide toe box to protect your feet. Avoid walking barefoot. Orthotics. Consider using custom orthotics to provide additional support and cushioning for your feet. Walking aids. Use a cane or walker for added stability. Safe walking surfaces. Walk on smooth, even surfaces to reduce the risk of falls. Avoid walking on uneven terrain, crowded areas, or in low light conditions. Balance exercises. Perform balance exercises regularly to improve stability and reduce the risk of falls. For individuals with severe arthritis, it's crucial to strike a balance between activity and rest. Opt for activities that support mobility without overloading the joints. Pay attention to your body's signals and adjust your routine as needed to minimize pain and prevent further joint damage. Conclusion: prioritizing personalized care and informed choices. As this guide illustrates, while walking offers numerous health benefits, it's not universally suitable for all older adults. Specific health conditions, such as blood pressure instability, heart problems, recovery from surgery, peripheral neuropathy, and severe arthritis, can make excessive walking detrimental. Recognizing these potential risks and adapting exercise routines to individual needs is essential for preventing health setbacks and promoting a higher quality of life for seniors. The key takeaway is the importance of personalized care and informed choices. Before embarking on any exercise program, older adults should consult with their healthcare providers to assess their individual risk factors and develop a safe and effective activity plan. This plan should consider their specific health conditions, functional capacity, and personal preferences. Furthermore, it's crucial to listen to your body and pay attention to any warning signs, such as pain, fatigue, dizziness, or shortness of breath. These symptoms indicate that you may need to slow down, modify your activity, or seek medical attention. Ultimately, protecting your health after 70 isn't just about staying active, it's about staying active the right way. By making small, smart adjustments to your exercise routine, whether it's reducing your walking distance, switching to lower-impact exercises, or using proper support when needed, you can maintain mobility without putting yourself at risk. Taking care of your body today means enjoying better health, more independence, and a longer, more fulfilling life tomorrow. We'd love to hear from you. What's one thing you've learned from this discussion, and how do you plan to use it in your life? Your thoughts are important, so don't hesitate to share them. If you found this discussion helpful, please like, subscribe, and share. Your support helps us continue creating content that informs and inspires. Thanks for reading, and we look forward to connecting with you in the next video.